Hey everyone, Dr. Badawi here. I'm a general dentist in beautiful Sterling, Virginia. And in this video, I'm going to share with you some of the deepest insights I can give you as a dental professional. I'll be sharing with you the top 5 questions you should ask your implant provider before committing to surgery. This will help you determine the credibility of your provider on a deeper level in a short amount of time. Let's begin. All right, you're back. Let's dive right in. Question number 1. What is your provider's formal education in dental implantology? Who are they trained by? What form of training did they receive? How long did they take to go through the training? These are all questions related to the dentist's professional schooling on dental implants, and they're really important. For example, I've gone to multiple CE courses where I've studied under board-certified surgeons on how to place implants. This means I've devoted hundreds of hours taking notes, learning every possible complication that can occur, and then I had to pass rigorous exams that were proctored by other implantologists who were overseeing my training and apprenticeship in these programs. So as a person looking for an implant, make sure to ask for the dentist's formal education background. And if they don't have an extensive amount of formal training on implants, I would go as far as to ask for a guarantee on those implants. You want to make sure the person who is placing your implants is credible. Question number 2. Does the dentist have a 3D CT scan? So this is something that patients don't understand. There is a significant difference between traditional X-rays and a 3D CT scan. An X-ray is a two-dimensional image that shows you the layout of your bone structure. In the case of placing implants, an X-ray would show you how close your tooth roots are, how thick your jawbone is, and other implant territorial details that would allow us to place the implant safely. However, X-rays still leave marginal room for error. It is up to the dentist's interpretation and usage of the X-ray images to place the implant safely. A 3D CT scan dramatically limits this risk. A 3D CT scan allows us to get a complete map of your bone structure so that we can plan every step of the surgery before it happens. It also allows us to create 3D printed surgical guides so that the implant is placed in the bone in the most accurate and precise angle and depth possible. In short, a 3D CT scan limits your potential of error by a large margin. If you're looking to get a dental implant, try to go with a dentist who has one on hand. We have a 3D CT scan here, and we use it every day. I personally wouldn't want to place implants without having one. Question number 3. Will the dental implant and the crown be placed at the same office? So in many general dental offices, they will separate the implant process between two dentists. One dentist will be the actual surgeon who places the dental implant into the jawbone. The other dentist will be the one responsible for placing the crown on the implant. There's nothing wrong with this approach as long as the two doctors work closely on this approach. I've seen some weird cases in the past where the patient went to one dentist to place the implant and then went to a whole different office to have the crown placed. The end result was a weird-looking dental crown. The patient didn't like how the crown looked because the dentists failed to collaborate effectively. So I would recommend trying to work with an implant provider who will be working closely with the dentist who will be placing the crown. Make sure the whole process is done under the same roof. This will decrease the margin of error and increase the likelihood of your final crown looking perfect. Question number 4. How will your dentist take into account your specific medical conditions? The success of your implant surgery will depend on how your surgeon takes into account your medical conditions. For example, people with uncontrolled diabetes will have a much harder time healing from the implant process, so they will require extra steps to ensure a successful end result. Another factor is vitamin D deficiency. We will ask for your vitamin D levels and to get vitamin D treatment if the vitamin D levels are not adequate for implant surgery. Vitamin D levels below a certain point will affect the ability of your body to accept the dental implant and to process and metabolize the biomaterials that we place. So you might get a failed result if your vitamin D levels are not controlled. If you are an excessive smoker, that could also negatively impact your dental implant results. Question number 5. How accessible will your surgeon be after the procedure? This is an absolute must. The fact of the matter is, there's a small chance that something unexpected could happen after your surgery. The implant provider may have done everything perfectly to a T, but for some reason, your stitch comes out a week later. And now you're freaking out because you think your implant might fall out or your mouth could get an infection. What would you do? Can you call the surgeon and get it taken care of? You should have your surgeon's word that they will prioritize you if something wrong is to occur. I also want to add a side note here. This is why I get concerned when I hear about people going and getting their dental implants done in another country. If something happens after they get back in the United States, they're going to have some serious logistical issues. If you get an implant in Mexico or India, you come back a couple of days later, something wrong happened. You're gonna have to fly all the way back there to get the issue fixed. It's a problem. Anyway, that concludes all the content. Those are the top 5 questions you should ask before committing to surgery. I hope this gave you insights on the variables you should consider as an implant patient. If you found value in this video, go ahead and give us a thumbs up and share it with your friends. Until next time, this has been Dr. Badawi with Westlake Dental Care.